Welcome to our live webinar series, Connection and Care in an Era of Social Distancing. Today, we'll be discussing diabetes with Dr. Leonardo Akan. Dr. Akan is a pediatric endocrinologist. He obtained his medical degree from the University of the West Indies and completed his pediatric residency training at the University of Miami Jackson Memorial Hospital. After obtaining his board certification with the American Academy of Pediatrics, Dr. Akan then completed a fellowship in pediatric endocrinology at the University of Miami before returning to Trinidad and Tobago. Dr. Akan has been practicing in clinical pediatrics for over 20 years. In private practice, Dr. Akan has started a comprehensive newborn screening program for inborn errors of metabolism, newborn hearing, and vision screening. He is certified in insulin pump training and runs a support group for patients with continuous glucose monitoring systems. Dr. Akan is also employed with the North Central Regional Health Authority as a consultant in pediatrics. He is also an associate lecturer in pediatrics with the University of the West Indies. Dr. Akan, welcome and thank you for being with us today.
Thank you for that introduction. My talk today that I would like to focus on would be COVID-19 and diabetes. Hopefully, good morning to the listening audience, and thank you for tuning in. Now, as is common knowledge, we are in the midst of a global infectious epidemic caused by a type of coronavirus, which leads to a condition called COVID-19. Common signs of this infection include fever, cough, breathing difficulties, tiredness, muscle aches. Symptoms usually start within 3 to 7 days of exposure to the virus, but in some cases, it has taken up to 14 days for symptoms to appear. People of all ages can be infected. In 80% of cases, COVID-19 is mild with minimal flu-like symptoms. Some have shown no symptoms, or it just feels like the common cold. 15% of COVID cases, however, will be severe, and 5% of cases will lead to critical illness like pneumonia, kidney failure, and heart failure. However, 90% of people infected so far have survived, leading to an approximate 2% fatality rate. Older people and people with pre-existing conditions, such as diabetes, heart disease, and asthma, appear to be more vulnerable to becoming severely ill. In people with diabetes, the stress of the infection, like other infections, causes blood glucose levels to fluctuate, and some viruses may thrive in an environment of elevated blood sugars. Also, diabetic patients have an immune system that is already compromised, which makes it harder to fight off some viruses. People with diabetes may have diabetic complications such as kidney disease, heart, and circulation problems. Of note is that some infections can trigger diabetes in previously undiagnosed people. So we need to monitor for signs of new onset diabetes, signs like frequent urination, excessive thirst, weight loss, tiredness, vomiting, and abnormal behavior. Now, insulin is a chemical hormone that the body produces in response to sugar levels. It opens the pores of our internal cells to absorb sugar from the bloodstream. Diabetes mellitus is a chronic condition where your blood sugar levels are above the normal values due to either a lack of insulin production, known as type 1 diabetes, or there's an impaired insulin effect on the body cells that normally absorb glucose, known as type 2 diabetes. Blood sugars can be temporarily elevated during pregnancy, stress, infections, and the use of certain medications such as prednisone. Also, there are specific causes of diabetes due to other conditions. Example, diabetes in newborn, or there's a condition called maturity onset of diabetes of the young, where your glucose sensor doesn't trigger the release of insulin. Also, there are other conditions that damage your pancreas, the organ that makes and releases insulin, conditions like pancreatitis or cystic fibrosis. What are the effects of hypoglycemia or elevated blood sugars? When your blood sugar levels remain persistently high, it crystallizes the proteins and fats that line the blood vessels, and they now become damaged and scarred, and poor circulation results. Sort of like having a glass of water, and you have a spoonful of sugar. If you stir it, that first spoon of sugar dissolves. If you keep on adding sugar to that glass of water, it reaches a saturation point where it can't dissolve anymore, and it becomes syrupy and crystally. So the same thing happens in your blood vessels. So atherosclerotic cardiovascular disease is the leading cause of death due to heart attack and stroke in diabetes. Poor circulation also leads to kidney failure because you have poor blood vessel circulation or poor oxygenation of the kidneys, the eyes, the nerves, and there can be other metabolic problems. However, if we keep your blood sugar levels in a good value, you don't reach that saturation point, you don't reach that high crystallization point, and your circulation will be much better, will be normal, practically normal. So what can people with diabetes and their loved ones do? We can take precautions to avoid the virus if possible. So try to avoid touching your face before you've washed your hands for 20 seconds and dried them. Clean and disinfect any objects and surfaces that are touched frequently, like door handles. Don't share food, cups, towels, tools, etc. Avoid contact with anyone showing symptoms of respiratory illness, such as coughing. And because a few people may be asymptomatic spreaders, try to avoid going out in public if possible and stay 6 feet or 2 meters away from people who may be carrying COVID-19. Wear a proper mask to reduce virus spread and infection. Stop smoking. Enter into a stop smoking program. Now, if you have diabetes, prepare in case you get ill. Have your medication and supplies available so you don't run out of them. And have your medication and doses written on a paper for health professionals to quickly see. Pay extra attention to your glucose control via frequent monitoring of your blood sugar values. Regular monitoring can help avoid complications caused by high or low blood sugar values. Try to keep your values between 70 and 180 milligrams per deciliter. Consult your healthcare professional if you start showing flu-like symptoms. If your blood glucose levels stay high, it may cause you to urinate more frequently, and you will need to keep hydrated. So have a clean water supply handy. Be careful if you have kidney problems though. If you take insulin, you may have to take extra insulin if your blood sugar levels stay high. And check your urine for ketones, a specific type of test, if your blood sugars are more than 240 milligrams per deciliter consistently. Make sure you have a glucose source to ingest in case your blood sugar levels drop too little, something like juice. Try to get someone you can rely on to get you help or assistance if you become ill. And so let's make sure we check up on our diabetic friends and family. Try to get sugar-free cough syrups. Please know that excessive paracetamol, common brand names being Panadol or Tylenol, can cause false readings if you have a continuous glucose monitoring system, not the Dexcom brand. It can also be toxic to the liver and kidneys. Aspirin can also drop your blood sugar. Ibuprofen can exaggerate the glucose-lowering effect of insulin. And if you can get it, a glucagon pen injector kit can quickly reverse low blood sugar attacks if you are passing out due to low sugars. Message your doctor or diabetes educator with any concerns, and you can use telehealth solutions for consults like this one. Join a diabetes support group. Wear your medical lid bracelet that shows that you are diabetic. Regarding nutrition, give priority to foods that don't accelerate extra high blood sugars. That is, use low glycemic index foods, such as vegetables and whole wheat foods. Avoid excessive consumption of fried foods. Choose lean proteins, like fish, meat, eggs, beans, peas. Eat fruits in 2 or 3 servings. Exercise, also an important part. Exercise is of great benefit in people with diabetes. It helps lower blood sugars and increases insulin sensitivity. It builds muscle strength and endurance. Try to do daily exercises at home. You can follow an online class or video. Exercise can reduce heart disease by up to 40% in some people. Keep your sugars between 100 and 250 milligrams per deciliter when you exercise. Note that you can drop low up to 12 hours later. Now, these sugar values I'm giving are in milligrams per deciliter, but there is also conversion to millimoles per liter. Now, studies out of Wuhan, China. Early studies, 25% of people who went to the hospital with severe COVID-19 had diabetes, and they had a 7% death rate. The average age of people with diabetes admitted to the hospital was 66 years. People with better glucose control did much better than people who had poor control. There is no proof that diabetics have an increased risk of catching COVID-19, but if you get it, there's an increased risk of going into circulatory shutdown and shock. So seek immediate attention if there's difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face, which would indicate a lowering of the normal oxygen levels. If someone at home has COVID-19, try to keep them in their own room and keep all utensils used by them sanitized. People with diabetes are at increased risk of pneumonia, which is an inflammation of the air exchange tracts in the lungs. Now, other germs can cause pneumonia as well, so it is recommended that diabetic patients have their pneumococcal and annual flu vaccinations. Additionally, Obesity is also a risk factor. Overweight patients have an abnormal secretion of chemicals called adipokines and cytokines. These are chemicals which can impair the immune response. Also, overweight patients have increased difficulty to ventilate and oxygenate, and they also have increased risk of obstructive sleep apnea. As we said, diabetic patients have increased kidney and ischemic heart disease risk, which puts them also at a high risk of danger. In patients with type 2 diabetes and severe illness, their medications may need to be adjusted. So metformin and SGLT2 inhibitors should be stopped. That's like Jardiance and Forxiga. Other medications can be used, like the DPP4 inhibitors. Some other drugs, such as sulfonylureas, may cause hypoglycemia, especially if the appetite drops. And because there can be a reduced smell and taste in COVID-19, you may need to take anti-nausea medications. Some long-acting GLP-1 receptor agonist drugs, which are injectable, have a long half-life, and that might be problematic if the sugars go high or low. And insulin may need to be started to help control blood sugars. One of the medications that's been touted maybe to help with COVID-19 treatment is hydroxychloroquine. And some studies have shown that hydroxychloroquine and metformin combination may be fatal. This is studies done in mice. Some researchers think that the hydroxychloroquine works better with zinc. So let's at least take our multivitamin that has zinc in it. There's no link to stopping the ACI or the ARB antihypertensive medications. If you get sick, it might be a minor illness, so try waiting it out for 7 days at home if you're stable. Check your feet daily to make sure no hidden infections or bruising. And find ways to de-stress. Rest, exercise, yoga, stretching, meditation, prayer, indoor hobbies, maybe find a new one. Talk to somebody or keep a journal. Stay informed with limits and credible sources. You can go online and download a sick day plan for adults and children. You can use the site called diabeteseducator.org. Other resources would be the Diabetes Association of Trinidad and Tobago, the Ministry of Health, the International Diabetes Federation, the Juvenile Diabetes Research Foundation, the American Diabetes Association, and the International Diabetes Federation. So let's be aggressively prepared and fight COVID-19 together. Thank you for everyone taking care of people with COVID-19 and diabetes, and thanks to the listening audience.
Dr. Akan, that was really informative, and I'd like that you gave us some resources at the end so we can continue our education about diabetes and juvenile diabetes. We have a question from one of our attendees. Does the liver release additional stored glucagon when a diabetic has a virus? So patients should test more frequently.
It does, and also cortisol is another stress hormone that is released during infections, and cortisol impairs the way the body uses insulin. So for these reasons, the blood sugar levels are high, and you'll have to check more frequently whenever you're unwell. You check your blood sugar values.
Okay, and a second question, do you have any information on the use of vitamin D or vitamin C in relation to COVID-19?
Some studies have shown that vitamin C levels are also can be helpful. Vitamin D studies are ongoing.
We have another question. Please list the drugs one should stay away from if they come into contact with the virus and is currently taking metformin.
Right, so metformin is one of the drugs that they said need to be carefully monitored because you can have poor circulation, and poor circulation will mean that the levels of the metformin become more effective, and there's a condition called lactic acidosis that can be fatal. So you have to be very careful. You shouldn't just stop medications. You should talk to your doctor first before stopping any medication. But the resources say to be careful if you're taking a drug called metformin on another medication, another anti-diabetes medication called SGLT2 inhibitor. That's like Jardiance or Forxiga.
Okay, I think for our attendee, there's no one list of drugs that fits all.
Just regarding diabetes medication.
Right.
Ibuprofen, as I mentioned before, we tend not to use ibuprofen for fever control with certain viral illnesses. because it can cause ulcers if you use for a prolonged period of time. So we tend not to use ibuprofen in certain viral illnesses, and they think COVID-19 might be one of those illnesses.
Right. There's certainly a lot that we have to learn about coronavirus. So we will know more about those as time goes on. Would you agree that diabetes appears to be the worst medical condition of all in dealing with COVID-19 infections versus kidney or cardiac disease?
I'm not sure. I'm not sure if they've tabulated all those risk factors to say which was diabetes, high blood pressure, kidney disease, especially since patients with diabetes may have some cardiac disease and some kidney disease. But we definitely know that you can go into shock, so kidney diseases are a problem. And we know that you can have inflammation of the heart. So we know that cardiac disease is also a high risk factor. So maybe because diabetes, if you have poorly controlled diabetes, you have a triple whammy, basically.
Right. Okay. And how often should a person with the disease for over 20 years do blood work? And what should be checked specifically?
Okay. So it depends on the type of diabetes you have. All right. Over 20 years, if you've had poor control, you start seeing the effect of that glycosylation of the tissues. So you need to check your kidney function via blood test. You need to check your urine function to see if you're spilling proteins in the urine, because if you're spilling proteins in the urine, it means that the kidneys are not working at an optimal level. You have to check your liver function to make sure that your liver is functioning well, especially with diabetes, because there are some other metabolic complications. You do have abnormal cholesterol, so you want to check to make sure that you're not getting any cholesterol deposit or gallstones or liver issues, or that none of your medications are affecting your liver. You need to check your blood count, because some types of diabetes, you can also become anemic. In type 1 diabetes, which is an autoimmune disease where the white blood cells attack the insulin or the insulin-making cells, you can have other autoimmune diseases. So you have white blood cells that can attack the thyroid, so you need to check your thyroid level. You will need to check for other autoimmune conditions like celiac disease that can develop with diabetes. You should also have your eyes checked to make sure no cataracts or early eye disease, because before the cataracts, you may see some changes in the eye blood vessels. You should have your cardiovascular function checked to make sure that your heart is working optimally. So you should also see your cardiologist, or your diabetes doctor should have you see your cardiologist.
Right. Okay, that's a great tip. At the moment, we don't have any questions in the queue, so I was wondering if while we have one more question. How is it? Well, I'll read it as it's typed. How sore is it to do the laser for cataract having type 2? Maybe the question, how safe is it? Yeah.
It's very good because it basically reduces potential leaky blood vessels, because the blood vessels can leak into the eye and cause damage. So they think that, yes, checking the eyes for cataracts and diabetic eye disease and doing laser therapy to eliminate blood vessels that can leak into your eye, it's very good. That's one of the reasons why you have your eyes checked.
Right. And I was going to ask you to tell us a bit about pediatric endocrinology and how that might differ from caring for an adult who has diabetes.
It has its own tricky management guidelines, because it's very hard sometimes for a child to force a child to eat when they've taken their insulin. Most cases of diabetes in children it's a type 1, right? Autoimmune disease where there's destruction of your insulin or insulin production cells. And so usually you have to take insulin to control your high blood sugar values. So sometimes this can happen from, you can have neonatal, as you mentioned before, it can be 2 years, 3 years, 8 years, 7 years, 8 years, teenagers. So it has its own particular management skills. So you have to be very gentle with kids in terms of getting them to eat and help making sure that when they have taken their insulins, that they do eat. And then, I mean, kids will want to run around and play. And so their blood sugars might drop. And so you always have to have a close eye on kids with diabetes. Most first world countries, the children have continuous glucose monitors. So that is an implant, that's an device that adheres to the skin, and there's a tiny little needle that goes just in the subcutaneous tissue of the skin, and you change it every week to 2 weeks, and that can give you a continuous monitoring of your blood glucose values. And because the kids do get fed up sticking their fingers a couple of times a day. They get fed up and they get depressed. So the glucose monitor will go a long way. Continuous glucose monitor goes a long way in terms of managing your diabetes. There's also an insulin pump where it's with a second needle, it goes in just under the skin, and that delivers the insulin automatically. Well, not automatically. You have to program it, and then it can inject insulin. So it also helps it provides a better outcome. The most important thing for the kids and the adults is that you check your sugars frequently, especially if you're on insulin. Kids with diabetes, luckily, there has been no studies saying that because they don't have the long-term complications, there haven't been any studies saying that diabetic kids are at increased risk of danger with the COVID-19. But I think it's just a matter of when studies come out, we will see. We'll see how much they're affected.
Right. And you've even preempted one attendee's next question, which was whether children who have diabetes are at the same risk as other children in terms of contracting coronavirus.
I think it's like with all viral illnesses and diabetics, there's an increased risk of not doing well because nausea, you don't feel to eat, you have increased stress hormone release. So you have your sugar values tend to be a little bit harder to control. So it's just more difficult to control the blood sugar values.
Okay. So I think we've dealt with all of the questions that our attendees had. I have one other one coming. Methods of treating pediatric diabetes, would it be advisable for adults to contemplate such treatment?
You need to repeat the question.
The methods of treating children with diabetes, you have just mentioned the of how they monitor their glucose and the insulin pump. Would you also advise something similar for adults? Or would that be useful for adults to look into?
Definitely, the more frequently you check your blood glucose levels without becoming too neurotic about it, you have a better long-term management outcome. I think it reduces, by frequent blood glucose monitoring, you can reduce the risk of long-term complications down by 60%, 70%. Right? So as part of the standards of medical care of diabetes, they had a consensus statement. CCM, for chronic medical care, is a personalized long-term plan utilizing a whole team of diabetic specialists but centered around the patient. And they found, and interestingly, telemedicine is an integral part of that management plan for 2020. But they found that if you are more aggressive in taking care of your diabetes, you have a far better outcome. So you, the patient, you have to take charge of your diabetic condition.
And we have a physician question here. While diabetics are more prone to Pseudomonas infections, should we use ciprofloxacin and Zithromax, as it seems that Zithromax is the antibiotic of choice?
It'll really depend on a case-by-case basis. Really, if the patient has, depending on the type of pneumonia, depending on if they have diabetic ulcers, diabetic foot ulcers. So it depends. Right now, these Zithromax is still being studied. So yeah, so I don't think there's anything specific related to the to Pseudomonas protection and what antibiotics to use.
Okay, thank you. Well, Dr. Akan, I want to thank you so much for making time for us today. I know that you are still busy seeing your patients, and thanks for sharing that wealth of information with us.
Thank you very much. Thanks for the invitation, and thanks again to the audience for listening. And thanks to everybody taking care of diabetes out there.